So today I'd like to discuss different ways to build confidence as a new nurse. As a new graduate nurse, as a new practicing nurse, as a new employee within a facility, there's a lot of different things that you have to learn, and you need to be able to adapt very, very quickly. As a new graduate, when I passed the NCLEX, I started within different populations. I was working within inpatient psych and within corrections, so I kind of had a different path. But when I started at my first medical surgical telemetry job, it's when I really felt like a new nurse. It's when I realized that I needed to learn so much more. I needed to reflect on everything that I had learned from nursing school and now apply it. So obviously, I was terrified. I was terrified being in a new environment. I was terrified that now I really have lives in my hands. I'm not just running therapy groups or checking vital signs. I'm really medically caring for patients. In nursing, there's so much to do, there's so much to learn, there's so many opportunities for growth. So now, being 5 years into my clinical practice, I thought about what I would have wanted to know in order to build up my confidence as a new nurse. So the following are a few tips that I have compiled. The first tip to successfully being confident as a new nurse would be to take your time. If you are rushing because you feel pressures from a patient, from other employees, from the demand on a floor, you're more prone to make mistakes. So rushing and not taking your time, you're more prone to errors, and you might actually harm patients. You might harm yourself. If you're rushing and you're trying to give an injection, you might get a needle stick. If you are prepping medications and you're feeling pressure because you need to pull out medications very quickly, people are behind you waiting for you, they're tapping their toes, she's taking so long. No, you need to double and triple check the medications that you're pulling out of this Omnicell, this Pyxis, and then giving the patients. You can't just pull them and run to the patient and give it to them. You need to be able to take your time and understand everything that you're doing. You need to be able to look at a situation and think about what you're going to do next. You need to analyze, you need to critically think. And that actually leads into my second tip, which would be to reflect. As a bedside nurse, you're first going to start your shift by looking up your patients and getting a better idea as to how your shift will plan out. You're automatically triaging the important tasks you need to perform. You are triaging your patients based on acuity, and you're listening to report from other nurses as to how your shift will be. So by triaging in the beginning of your shift, you are thinking about what you will need to do first. What can wait, what cannot, what is more acute, what is more stable. So by reflecting on that and starting your shift by triaging, I think you're going to better adequately prepare for a shift. As a now experienced nurse, I'm finding that I reflect before I go into a patient room. In the time that I am steering my computer on wheels into the room to avoid all the furniture, in the time that I am getting hand sanitizer, I'm reflecting on what I'm going to do. What am I going to accomplish by going in this room? What do I need to ask the patient? What do I need to assess before I do anything? What do I need to educate this patient? What supplies do I need? So I'm reflecting so I can save my steps. I'm reflecting so I don't make errors, so I don't rush. I'm reflecting so I can critically think based on my assessments that I'm making in that room. I'm adequately preparing myself by reflecting. And also a big component of that is reflecting on what you actually did. What could I have done better? Ask the patient. They're the ones that you are educating. Maybe they can educate you. There's always room for improvement. You can ask staff. You can find a mentor. You can find someone to help you and guide your future practice and become a better and clinically skilled nurse. So reflecting on your own practice and accepting constructive criticism is half of the job as well. The only way to learn and grow as a nurse is to listen and to adapt and to be willing to change not only yourself but your practice to be safer, more efficient. And by reflecting before and after you do anything within nursing, you will improve your practice. My third tip to gain confidence as a new nurse would be to trust your instincts. And I have a clinical example. So when I first started within MedSurg, once again, I was new. I only had a psychiatric and criminalistic background. So everything within the medical realm was new. The analyzing telemetry, the assessing of the patients, really getting hands-on with care, it was all new. So I had a patient and I was on a general medical surgical telemetry floor, general medicine. Acuity, not so much. Everyone was a floor patient. So although somewhat stable, it was a lot of chronic disease management. So I had a patient and she was on 6 liters of oxygen. She was shaking, actively tremulous, actively anxious, and kept on pressing the call light. So every 2 minutes, ding, 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 she needed something. So I would go in, I would ask, and she just was so anxious. And when I started looking back, I reflected and I said, something else is wrong. It's not just the anxiety, there's something else. Respiratory, I automatically think when you're struggling to breathe, you have this anxious feeling, this feeling of impending doom, this feeling that you can't expand your lungs fully and can't breathe. That must be terrifying. I would be anxious too. So I started thinking about it more, and she was maintaining her sats at that point, but something else was going on and I just couldn't figure it out. So I trusted my instincts. I went to my charge nurse and I said, can you just look at this patient with me? All of my other older, more experienced coworkers were saying, you're just trying to not have her as your patient because she's annoying and pressing the call light. No, you know what? I would rather someone press the call light 1,000,000 times if I can help them. And at this point, I didn't know how to help her. I couldn't give her anything that was going to assist with her breathing at that point. I had gone through all of my medication options for anxiety and for respiratory. I tried to provide comfort and nothing was working. So something else was happening and I couldn't figure it out. So I called in resources. My charge nurse looked and said, I understand what you're trying to say, but I can't put a finger as to what's going on. I can't put a finger on it. So I ended up paging my team leader, and she was busy placing IVs on a different unit. And on the phone, I explained and I said, something just isn't right. I don't know what it is. She's really anxious. I can't help her. I don't know what to do at this point. Do you think you can just lay eyes on her and get a better assessment and help me out? And she had said, yeah, sure, of course. Let me just finish placing some of these IVs and then I'll be right over. So in the time that I took to page the team leader after I had left the room with the charge nurse, answer the phone call, put the phone down, I went back into that room and my patient was dead. Dead. Her lips were blue. It took 10 minutes and she was dead. So I ran out of the room. I called a code. Everyone starts rushing in. We're doing chest compressions. She was actually intubated in that room. And I didn't know what to do. I was running my first code in this first time where I had felt something was wrong. And I was right. So the doctor's asking me questions about this patient. I'm shaking like a leaf and I'm like, the patient is 56 years old. She was admitted for respiratory failure in the scene. And he's like, tell me what we need to do right now. What were her presenting symptoms with this situation? And I explained everything and he said, you were right to question. You were right to understand that this wasn't a regular presentation. And it wasn't just anxiety. It was straight respiratory. Straight respiratory. So as this patient is being intubated, as we're doing chest compressions, and then as she's being rolled off the floor to be transferred to the ICU for critical care, my team leader, she looked at me and she said, you were right. You knew something was wrong and you trusted your gut to get other people in that room to try to figure it out with you. You might not have known how to identify the situation at that point in time, but you knew that you needed more resources in that room and you trusted your gut. You trusted your instincts. And the next time you get that weird feeling that something is off, I am running over here instead of putting in more IVs. I am running. By trusting my judgment, by trusting my instincts, I saved that woman's life. She was intubated. She actually got discharged a few weeks later, but she was in acute respiratory failure again. And I saved her life by trusting my instincts. And my fourth and final tip for gaining confidence as a new nurse would be to ask questions and not be afraid to do so. Experienced nurses are experienced for a reason. They've seen so much. They've done so much. So ask them, utilize their knowledge and their ability to assist you in these clinical situations. The only way you're going to learn and grow is if you ask questions. And by asking questions, you are solidifying your own knowledge and your own practice. If you don't know how to do something, are you just going to go into the room and start doing it? Like, I don't know how to put a Foley in, but spread them. No, if you don't know how to do something, have someone come in with you. If you don't understand something, if you see something and you're not sure about it, ask questions. You're never going to be shunned because you're asking questions. Being inquisitive means that you're taking your time to think about a clinical situation and try to analyze it. And if you can't analyze it on your own, other people can come in. More sets of eyes, other people coming into an outside situation, they're going to have an outside view. You received report on a patient, you understand them, hopefully, at least 75% of the material, more than another outside view. So ask questions. Avoid making mistakes by asking those questions. Avoid doing something that you're not comfortable with or that you don't have the background knowledge to do safely and appropriately for this patient. Because in the end, by taking your time, by reflecting on your practice before and after, by trusting your instincts, and by asking questions, you are going to be a better nurse. You are going to gain the experience that it takes to take you further in this profession. So I hope this video helped. A nice brief tutorial and 4 quick tips on how to gain confidence as a new nurse, as a new employee, as a new grad. So take your time, reflect, trust your instincts, and ask questions.